Okay, good morning, everybody. Thank you for joining. You're here to participate in today's webinar. It's the second of a two-part series that we've done called Designing a Smarter Health Plan. My name is Chuck Batchelder. I've been with Filice for about 13 years now, and I've worked across all markets. I'm a very strong proponent of alternative funding strategies. I've seen how effective they are for organizations, and particular organizations that want to take greater control of their benefits program. So before we get started, I do want to let you know that you can submit questions at any time in the presentation through the portal here. We're going to monitor those throughout the time that we're on the phone here, and we'll answer those as we receive them, or if we seem to have a lot of questions, you'll certainly have yours answered at sometime soon after the end of the presentation. So please ask questions. It really helps get the discussion started on your side, and we look forward to continuing that with you. And to get started now, with regards to this webinar, hopefully you guys participated in the first one. That's where you heard from my colleague, my partner, Dan McElhaney, and he discussed the basics of alternative funding in order to help you kind of have an understanding of the options that you have to take greater control of your health plan. But today, we're going to continue the discussion, and we're going to focus on what we call the best practices in health plan management. So we're going to go over a variety of topics. To begin, we'll go over understanding plan performance. We're going to talk about utilizing health informatics to guide your plan. We're going to discuss creating a wellness program that will complement your strategy, how to build effective communication, and then we're going to touch on ensuring that you're compliant, because that is critical to this entire consideration. So to get started here, whether you're looking to stay in a fully insured plan or you're going to make that jump to some sort of self-insurance, you're someone with responsibility for your health plan, and that means that you should really be aware of your plan's performance and be able to articulate it to your management team. So clinical and financial data should certainly be analyzed to the extent possible. And the availability of this data really depends on the carriers you use, the types of plans, and the size of your company. But the key here is to identify cost drivers within the plan so we can project future costs and examine potential strategies to reverse these trends. That's what we're trying to do, is control costs and reverse trends through these strategies. So once you understand how your plan performs, it doesn't always happen so easily, but the next step is to look at how you can maintain positive trends and reverse the negative ones. It's important to understand there's things that you can't do anything about, and of course there are things that you can have more control over. But in most cases, things like your employee demographics, this is your age, your gender, the location of your organization, the type of education that your employee has, a lot of things like that are determined by your industry. You might not be able to do too much about these factors, but they're a very important component to help identify the successful health plan strategy, because your financial liability is linked to the health and wellness of the plan participants and directly to the demographic information that provides insight into the type of frequency of claims that you can expect. Employees with a highly manual workforce, those types of employers are often higher risk for immediate or chronic industries, the type of work that they do. So often the work site really determines where employees also live and how much choice they have with where to receive their health care. Not necessarily too big of an issue with Bay Area companies, but we also have very transient workforces that come in from different areas, and sometimes the more rural areas can provide some difficulties there, but it's not too common in the Bay Area. So there are areas that you can actually control, though. So beyond what is out of your control, there are certain things that you can really do to influence the effectiveness. And this really starts with making sure employees are educated about their health benefits and how the healthcare system works in general. A lot of people don't know how it works, and they don't really pay any attention to it until they have to use it. But the more proactive education that we can provide, the better. It's really important that employees are encouraged to invest themselves into this process. And, in part of that process, it's really understanding having the employees understand really what's optimal use of a benefits plan. Making sure they're doing things that are pretty common sense, things like ensuring they take advantage of free preventive care, seeing primary care physicians or urgent care instead of going to an emergency room, using generic drugs. I mean, these are all things that you hear pretty typically, but these are important influences. And then, of course, there's things that you can do within your own corporate culture that will have a positive influence. Do you only offer healthy food options in the workplace? Do you have gym access? And then, of course, what kind of activities do you promote for health and well-being while employees are spending their time within their workday? So those really are the basics on that aspect. But when you invest in an alternative funding strategy, what you're really doing is looking for ways to exhibit greater control over your existing liabilities and create the future opportunities to avoid high costs. You've taken on a lot of responsibility in this process, and really that's the goal, control and avoid costs. But you want to do that in a mindful way, in a respectful way, because you are delivering important care to your employees through the health plan. So to start with this, you need to be able to get the information through analysis. And most of you that are on fully insured plans, you understand that the insurance carriers are really reluctant to provide a lot of this information, in particular within the small and mid-markets. But when you adopt an alternative funding strategy, the important thing is to really partner with a consultant that has the insurance and healthcare expertise, people that can produce and analyze and interpret and manage the claims data for your health plan on an ongoing basis. And really this is what we refer to as informatics, and that's what our team does. So with health informatics, you're able to analyze certainly your expected versus actual claims, and really that's the basis within the health plan strategy. But you're also able to dig a little deeper, and you're going to have the ability to review utilization patterns within medical care and pharmaceutical usage. And this is where you really start to be able to reveal the opportunities for discovering effective changes that you can implement on your plan design, things you can do to evaluate where wellness strategies or targeted health interventions will have the biggest impact for your company. So health informatics is really valuable with the self-funded platform because the company is liable for the financial outcome. And the greater your transparency is, the more control you're going to have. And you're going to hear me say that a lot. So we're going to take a little deeper dive into health informatics and give you a little more detail about that. Within the health plan, we've talked a little bit about this, but there's the various factors that drive your benefits cost. We talked about the demographics and the risk profile, certainly the number of claims and the plan payments that you pay for your care. And then, this really gets into the high cost areas, but the severity of medical conditions and, of course, the likelihood of future risk exposure. You're really trying to balance all of this at one time. And to understand the impact of these factors, the data analytics, the data assessment, the predictive analytics, those all need to be conducted by people that really understand that information. When the analysis is completed, we use evidence-based clinical interventions, and we make that concentrated effort so that you'll have important financial considerations to discuss to improve your plan performance. So I'm going to briefly go through the process of how informatics works, we start with the demographics. This is the underwriting basis, and it's really understanding your risk, so knowing what's entailed with your age and the gender of your population, because this gives you a basis of the likelihood for age-based health occurrences and the type of costs that are associated with that. And then you really move to monitoring the actual claims and the data utilization of the plan. So this is going to provide your financial transparency, so you have an understanding of where the money is being spent. This will give you insight into the cost inefficiencies and the financial leaks within the plan. So we're always looking for ways that we can be more efficient. It's important to understand the utilization trends. You're going to look at the patterns of behavior within the organization, and this will help you determine whether your plan is being over or improperly used. From this data, the company can consider making plan changes, modifying the plan to encourage higher performing utilization, and through that, you're going to try to produce more favorable financial outcomes for your plan. And then, of course, you have to consider your greatest risks. Tracking and following your high-cost claimants is crucial to managing costs. And typically, you set a threshold when a particular claim hits a certain level. You really start to monitor that, and that's an important component and piece of managing the plan because you want to be able to track what's coming on the horizon. So you're always, in particular, looking after these high-cost claimants. High-cost claimants, this is something on the self-insured side you never really see, but they can really represent upwards of 50% of your total healthcare cost. And that can sound a little scary, but that's actually the way healthcare works. And when you see it like this, it's, I think, a little eye-opening at first, but when you start to understand that you're really trying to understand the high claimant risk exposure, you can ensure that you have your proper case management resources in place, and you can do the work necessary to help drive favorable clinical and financial outcomes so that you can really protect those high-cost claimants from becoming stop-loss claims and continuous liabilities or out-of-control liabilities. So proper clinical and financial analysis provides the understanding of the high-cost claimant treatment, and this gives us an estimated cost for a particular claim and how this affects the plan throughout the year or even beyond. So with greater understanding and experience by managing these claims, it really gives your company the ability to work with your finance team. You really need to work with finance in partnership because you've got to be able to make considerations to manage cash flow. And then as you gain more experience, you're really going to have an understanding of how to adjust the amount of liability, what you're willing to absorb, and how those costs can be managed in the future over time for the plan. So finance is a big partner in this entire process, and you really want to make sure you have a strong partnership with your finance team. And then once we move beyond the finance side, we head over to the clinical side of things. And no plan is going to deliver a favorable outcome if you're not balancing the clinical and financial effectiveness of the plan. So the assessment of the clinical data certainly determines the existing risk exposure and trends to the plan, and this is where you're able to uncover the opportunities to enhance more favorable outcomes. And it takes that clinician experience to really offer those suggestions. This will give you insight into your plan's utilization, common medical trends within the company's population. I mean, there's certain people that will definitely have higher pregnancies depending on your demographics. If you have an older or aging workforce, you're going to have more common occurrences because of that. And really understanding that those medical trends is helpful. The assessment of the claims data will highlight your plan inefficiencies and healthcare issues that go along with low compliance for preventive care screenings and medical treatments. And it also provides insight in the prevalence of disease and chronic conditions. So these are things that continue to be big liabilities and high costs along the way, but things like your diabetes, your cardiovascular, infectious diseases. So with this information, it gives you the ability to determine considerations, whether they're medical or prescription related, but they'll give you the ability to discover ways that you can have plan design changes that are going to help increase compliance and proper utilization, because that will allow for improved behavior and drive better outcomes, ultimately reducing future health risks and financial risks for the plan. So some of these things are as simple as encouraging the use of urgent care instead of ER, or implementing high-performing prescription drug strategies, things like step therapy or mandatory mail order programs. And the beautiful thing about this is that when you have the data, you're really able to measure future liabilities against costs and impact, so you really can see if it's worth investing in a strategy because you can run analysis financially and clinically to help determine that. So a lot of times we hear about these ideas and we're not sure, is it going to work for us or not? Well, we can make a much stronger predictive analysis when we have the data, and that's the great thing about having this information. There's also the opportunity for value-based healthcare strategies. This is an area that's gaining a lot of traction in the ASO market, and this is when you really look to remove the obstacles for care and greater compliance for the treatment of the costly chronic conditions. An example of this is something like if you look to see the cost of the medical necessary clinical treatments for a plan, prescription drugs, and that sort of thing, and you look at what that is to the cost of the members. If you remove and then if you decided to implement those as part of your plan, it removes the financial barrier to care, and it reduces your large claims liability. And this is gaining a lot of traction right now within the ASO market as a good strategy. It really boils down to the fact that sometimes the cost of these programs to the plan is worth investing so that you can improve the health and reduce the future liabilities. And of course, when you're giving your employees the opportunity to receive free care to treat things like chronic conditions, it's making a strong statement that you're really investing in your well-being. So you really get a lot of goodwill by doing something like that. So the last piece of informatics that we focus on is really predictive analysis, and this is both clinical and financial. But this is where once we've been able to identify what's going on within the plan, we can make estimations about treatment, and we can determine things like how long something will be a claim. We can look at the considerations of what exists and what kind of outcome might be expected. There's things that come along with certain diseases or conditions that become liabilities. Certainly understanding that helps us predict the financial and clinical outcomes for our members. It also details anticipated costs, so you can monitor these high claimants. Certainly those that might be on the horizon. And if you can predict something's going to be a stop-loss claim, that's very helpful. Just to know that that's on the horizon. It's really one of those things that really comes back to working in partnership with finance so that they have a clear understanding of what's going on with the health plan. And this gives just a greater insight to the claim costs that have been incurred, but certainly those that haven't been received in the future so that cash flow can be managed effectively. Okay, so I know that this is a lot of information, and I hope that you're sending your questions in right now. Informatics, we're going to turn the page on that, and we're going to head into wellness. And it's really important that you understand that if you invest in a strategy like this, you're pretty much going to see a cost reduction right off the bat because you're going into an alternative funding arrangement. But the important thing here is that you're going to have greater benefits if you actually consciously build a culture of wellness and make an investment into a wellness program that will tie into your overall healthcare strategy. So wellness should certainly be considered and complement your benefits program, and your health informatics is a natural catalyst and a basis for where you should decide to focus your efforts. Because now that you've got all this data and this great information, you really have a stronger foundation to build a wellness program that's going to help support that. You want to certainly tailor your programs to the culture of the organization. You want to make it personal because your company is unique. There is no one-size-fits-all for wellness, so you want to make sure that what you do works within the culture of your organization. And obviously, you've got to get it right because employees that buy into the programs, we often say you'll kind of only get one shot at really doing wellness, and I do believe in that. So you've got to get it right from the beginning, and you really need to have a program that's going to be unique and get employees to buy in and invest into their health and the program that you're trying to provide to them. So what you're looking at here is a graphic that an illustration that provides a sense of the type of behaviors that employers find most important to address and to help support a better workplace, and a healthier lifestyle for employers. Healthier lifestyle for employees. Certainly, your own informatics analysis would help validate and uncover your population's needs, This is a pretty common representation of what employees today are focusing on with their wellness programs. And so we talked about making sure you get it right, and you'll know that you got it right when your staff buys into the program. And when this happens, it can be fantastic. I mean, it can really lead to incredibly positive change within the organization. We all read the stories out there. Some of the most highly regarded businesses, they continue to attract and retain talent within the organization because they have such a strong commitment to healthy behavior and lifestyles, and people like that workplace environment that's very supportive. So, to make real changes in the workplace, it's important that the majority of the workforce actively participates. I mean, we really need to try to get as many people involved as possible. And a lot of times people building a workplace wellness program for the first time are really unsure about how to drive that engagement. And we're going to go through some of the steps to really help you with that to get employees adopted into a program. And first of all is your strategy. It's really the first step to have your team members actively participate in a cohesive strategy. So you got to identify what is it that you really want to accomplish for your program. What's the focus going to be? Is it reducing smoking? Is it driving involvement into an on-site fitness program? Is it healthy eating? What is it for your organization? And once you determine a few key goals, you can really build a program that's going to rally around this foundation. Your communication is critical. You cannot overlook communication and the importance of effective communication. Once you've defined your strategy, you really need to figure out what's going to be the best way to connect with your employees and have them understand about the commitment to workplace wellness. When you begin the discussion with them, you should certainly be prepared to answer questions and really give people insight as to why this program exists and what you hope to gain by participating. These programs really should be convenient as well. Convenience is really a great factor to getting people to buy in. If you make it easy for people to get involved, they have a higher likelihood of getting involved. And sometimes the simplest ideas create a great foundation for this. And this could be everything from having healthy snacks in the workplace, hosting fitness classes on site, and there's some great mobile wellness technology out there that really enables people to connect with their employees if that's right for your culture. And some of these conveniences are just really effective, good ways to do that. It goes without saying that you should never overlook financial incentives as part of your strategy as well. A lot of companies out there find the best way to get people involved is through a little cash reward of some type. People do this in various ways. Some employers tie their wellness directly to premium discounts for the cost of insurance. Other plans are effectively doing this through funding of the HSA account or the HRA account, if that happens to be part of your strategy. But that's a great reward for employees, so they have money to go towards their health care or healthcare savings for the future. But you really need to determine how much you can spend. It has to be a discussion as part of your benefits budget, and when you're looking at your cost outlay for the cost of your programs, you've got to understand what kind of financial resources that you have there. But at the end of the day, the money is going to matter, and it's going to make people, it's going to incent people into starting into a program. And of course, with that money, the goal is the money's the carrot there, but the goal is really to help gradually make lifestyle and disease management shifts for people that are going to really become habits in their life. So the employee wellness programs, they do continue to increase in popularity because they have successfully demonstrated the effects of well-being. Companies who implement these healthy solutions for their team, they see the benefits in the workplace. They're happier workforces. You get a lot of great positive feedbacks. You really will find some great champions within your organization that when they invest in this, they've achieved great results. And sometimes those people will be your greatest advocates and helping get more people engaged. But if you start planning with the employee wellness program in mind, you'll see a community-minded approach will really deliver the best results and the most impressive results for you. Okay, so I'm going to dive into a little example here. I want to give you guys kind of a case that's really relevant to the combination of informatics and wellness and how this works together. And this actually is a little near and dear to me. It happens to actually be one of my clients. But it's an example of how our consulting team worked to develop a wellness program utilizing their health informatics to best understand their plan performance, the liabilities they had, and we built a program that really stressed engagement and rewarded healthy outcomes and behavior. So what you're looking at here is a chart that depicts a metal color or metal tier or color that represents an employee's level of engagement in the wellness program. The program was participation-based, and it provided employees with a financial incentive for either the HRA or HSA qualified health plan that they had. And what you're looking at are the blue people. They were our non-participants. These are people that we just could not get engaged in the program. Certainly, you can see if you stack up all the other bars there, we had a high engagement. You know, we really did have the majority of people engaged in the plan. But the bronze individuals are those that only participated in the minimum requirement, which was our online health risk assessment. The silver middle bar there includes the individuals that took the HRA and completed their biometric screenings. And then the gold and platinum, that represents employees that were fully engaged in doing healthy actions. So what we did here is that we identified the engagement levels and we tracked these members and their specific claims over time. And what you see here is that the illustration shows that the members with the highest level of engagement had the lowest claims cost. And that was really rewarding to see that actually take place there. We looked at this on an even deeper level. And one of the things that we noticed was that some of the members that we would have considered unhealthy because they had identified chronic conditions or even some higher claims in certain situations, what we noticed was that these people were falling into the higher reward levels because they were engaged and they were actually compliant with their treatment plans. So that helped minimize, while they still had claims, of course, it helped minimize the liability of high future claims. So the net takeaway on this program was that it was a great success. We really achieved strong engagement across various health statuses. We improved the compliance for members with chronic conditions because we offered programs and opportunities for them to take greater control. And that showed that the engaged employees had lower plan costs overall. So the client was certainly convinced that it was worth rewarding the healthy behaviors and making the investments into the HRA and HSA because that helped reduce the liabilities. And now our next step with this client is really to develop new ways to increase engagement because we see that we've got a lot of employees that we'd like to shift over that aren't engaged, and they've been a little slower to embrace wellness and taking control of their health care. So always some work to do, but this was really a great success. Okay, we talked a little bit about communication earlier, and I'm going to get into this in a little more detail here. There's a lot of studies out there, and despite employers' commitment to better education, there's still a general lack of employee understanding about benefits. And this isn't necessarily an area that's getting better, but it is an area that people are really trying to figure out ways to better connect with their employees. There's differences in the generations. Younger workers, the healthy, the invincible, they have a really low understanding oftentimes of their healthcare and how it's used because they're not utilizers so much, but they're also great adopters of technology and they're willing to embrace some of the great tools that are out there. So you really need to develop an understanding of your workforce and what's out there and really what's going to be best to connect with them. But the way that the employers ultimately communicate with benefits information to employees, it has a tremendous impact on how well the programs are understood and how well they're going to be utilized by the members of the plan. So there are some great resources out there that are available. There's one area that we think we continue to see great traction is the effectiveness of one-on-one consultation. It really stands out as a great way to engage with employees. It can seem overwhelming to think of having to connect with each person on one-on-one, but there's really good resources and partners out there that allow for that, whether that's in person or telephonically. And then, multimedia messaging provides great methods to connect with employees and the families that are on the plan, so they can recognize the value of the benefits and help make better decisions. But it's really critical, again, to match the right method with the culture of the organization and structure a campaign that's going to give sustainable messages over time to drive the behaviors for utilization that you're really trying to promote. So we're going to get a little more detailed in the communication here and what makes it successful. Certainly planning well in advance and making sure that you have defined your objectives, identify the key stakeholders within your organization and create a strategy and plan of action for reaching them. You also want to have a plan that offers both required and optional communication. That can be helpful along the way. And those strategies really start with making sure you've done your homework in advance. If you are looking at making changes in the future and maybe some of those changes might not be well received, you never want to sugarcoat the bad news. Employees are going to see right through that. They'll resent any attempt that you have at hiding benefit changes that can be perceived negatively. So you really should be mindful of informing employees of the changes as soon as possible. And the more time that they have within that period, if it's open enrollment or when the changes take place, the more smoothly that's going to go. You never want to assume that employees know why an organization might be making changes. So, being as transparent as possible can really go a long way for you and having credibility. And over-communicating is certainly much better than under-communicating. I think that we've seen plenty of examples where that's been the best strategy within an organization. Certainly stick to your messages. You really want to determine the key messages right up front and communicate them consistently. And consider your benefits, the communication materials, whatever you're putting out there, from varying perspectives, from all levels of employment and management within the organization. It's really important to think about how things are going to be perceived. Some of your best allies in communication can be your managers and supervisors. Often this group's overlooked and underestimated, but they're really crucial advocates, and they have strong connections. They have valuable influence over employees. Managers and supervisors should really be embraced as your partners because they're so effective in sharing information. And if you do it the right way, they will certainly be very supportive in helping communicate good news and difficult news. Since they are most likely to know and understand the employees, they're often also great partners just to present information. They're an employee's main point of contact, and supervisors tend to be more approachable for questions because of the relationships they have. And this helps facilitate better opportunities for asking questions and expressing feedback. And as that trickles back up to your departments, that can really help as you decide how to tailor communication for the future and do things differently. So you can kind of rinse and repeat, reinforcing messages as well. A lot of times during, in particular, open enrollment meeting, it can be a little overwhelming. I think it's really important to make sure you get the key messages out there, but then you also have great follow-up campaigns to really get information back out to employees, give people another opportunity to ask questions and have greater understanding.
And certainly try to use different vehicles throughout the course of the year to keep things fresh and show employees that you're engaged in whatever the messages are throughout the year. It's not just something you're going to move on from. Okay, so as we're going to shift now into compliance, and it's really important to understand how compliance changes for employers with alternative funding arrangements. There is a stark difference between fully insured plans and alternative funding arrangements around compliance management. Your fully insured plans rely upon the insurance carrier in most instances to provide a lot of the important details about coverage and claims administration. But with an ASO plan, you will have a far greater responsibility. So you need to make important evaluations about the capabilities that you have to take on the administrative compliance duties, and certainly consider what kind of costs might be involved or resources needed to delegate some of the duties outside of the organization to various vendors or third-party administrators. A TPA, the right TPA, really helps provide support and the critical expertise in a variety of areas. So whether it's your claims administration, which is certainly critical on a day-to-day basis, to the important things like creating your plan documents, making sure that those are completely in order, and even assisting with employee communication and advocacy along the way. So you have a much higher degree of risk to manage in that process. And then also our friends HIPAA and ERISA. Often these requirements will intimidate people because there's a lot of liability attached to them. It doesn't have to be that way. You just really need to make sure that you're informed about the liabilities that you have and that you're aware of how to address them to ensure that you're compliant. So in particular, as you look at HIPAA, under a fully insured plan model, your employer, you as the employer, your exposure to the PHI, the protected health information of a plan participant, is really limited. So it's kind of contained within enrollment and census information. But when it comes to an alternative funding strategy, you're going to have a lot more information, and you're likely to have direct access to claims, medical diagnosis, health histories, and really the treatment information of your participants. So you really need to button up this area, make sure you have tight controls over who has access to information, and that you have the proper checks and balances in place to protect that for your employees. So you're really going to need to go through some greater lengths to ensure that you have HIPAA compliance. And then, of course, there's the Employee Retirement Income Security Act, ERISA, and how it applies to all forms of employer-sponsored health plans, from fully insured to self-insured. But as a plan sponsor, you are responsible for ensuring your ERISA compliance. In the fully insured model, your insurance carrier partner really partners and assists with some aspects of the compliance, but in the alternative funding world, you're not going to have that carrier to rely upon, so you need to make sure that you have the right partners in place for direction, for the guidance necessary, and then certainly for the tools to ensure that you are compliant. So certainly we don't want compliance to intimidate you from entering these arrangements. It really boils down to making sure that you're mindful of it and that you have the right partners. The right broker consultant, of course, is where that starts, and then any added resources beyond that help complement your alternative funding arrangement. Okay, so that was a lot of information, and I hope that it was beneficial to you, because this is really kind of bringing us to our conclusion here. And I'm going to take the opportunity to editorialize a little bit on the topic. Alternative funding arrangements, honestly, for me, are probably where insurance becomes the most interesting. It's, the more control, the more transparency you have, the more opportunity you have to have a say in the outcomes And it's that transparency that gives the control over the health plan. Excuse me. And when you're making such a monumental investment in the cost of healthcare, it goes without saying to me, you really deserve, and certainly you can make the argument that you need to have insight and the capabilities to influence these outcomes. And this is where we can be creative. This is where we can really feel confident in making decisions because we're making decisions based on data and information that we have. So, determining the right strategy and implementing a finely tuned program really is just the beginning. You want to make sure that you have everything in place to manage that program, because when you do that the right way and you achieve results, it's really rewarding. I mean, I've seen some fantastic experiences where we've just had terrific success for organizations, and we've bent that cost curve, and we've really taken back control over a healthcare program. And when you're mindful of this and you have a great wellness program and you communicate effectively, you've got a program that's really going to produce great results within your organization. You're impacting the culture of the organization, and you're impressing finance, which is great, and you're doing really good things for your employees. And at the end of the day, you will hear some appreciation from them when they've got the right programs to support them. Benefits should be a benefit, not something that's an obstacle or deterrent. And great programs and great partnerships really allow for that. So, okay, that's the end of my editorial there. But, taking the next step, you're going to hopefully look for ways to improve upon your existing programs. You really need to partner with the right team, the right experts for that. Many of you on this call are already clients of ours, and we certainly appreciate that and look forward to having those discussions further to talk about these strategies. And those of you that might just be joining us as with some interest to see what this is all about, we certainly look forward to having some discussions with you. So I encourage you to ask more questions. Contact your consultant within the organization if you have one already. If you're a prospect out there, just feel free to contact us. I will editorialize again my own email address, Chuck, CHUCK @Filice.com. Feel free to email me directly or email through the questions that we've been receiving here. But we really encourage you to explore this. It's a great way to take control of your health plan. Hope it's been valuable for you. Hope you've benefited from this. And again, just really look forward to working together to create some future success, and we appreciate that. So thank you very much for your time, and hope this was beneficial for you, and have a great day.